Thank you very much. My name is Irina. I'm head of nursing for cancer, and I'm starting presentation. Next slide, please. Why the cancer patient experience program approach? King's PUI result in 2017 National Cancer Patient Experience Survey led to in-depth analysis of feedback and comments with the aim to try to understand why our performance is consistently poor and what we need to do to improve it. To reach out to our diverse population of patients and staff, we have run a lot of listening and engagement events and had to think creatively how to take opportunity to engage. Through this process, our vision for improvement was shared, our passion and ambition to lead and change invite many people to join us in a journey to help us to build trusting relationship with internal and external stakeholders. We have secured the trust support for cancer patient experience improvement program to become one of 4 King's strategic and quality priorities for 3 years because we realized we need time to make an improvement and sustainable change. This gives fantastic platform to engage with Macmillan and our South East London Cancer Alliance partners to deliver program of work as a strategy from all partners' support. Can we go next, please? Emerge 3 areas, and next, please, have been very much interconnected and interdependent, and you can see they're very broad. So in-depth understanding of issue behind these 3 areas required really a long-term investment plan, commitment and exploring, with a variation from establishing new services, trying new roles, to exploring process changes and piloting new ways of delivering care. The program approach felt to be best suited to oversee 9 project groups, which overall were addressing issues behind over 20 national cancer patient experience questions performing below expected range in the past 3 years at baseline. Could we go to next slide, please? Has the program approach worked? We believe it did, and we can demonstrate this by increase in our performance in a league table, first time in many years or since inception of National Cancer Patient Experience Survey by 30 places. With target improvement we put for ourselves at 10%. Could you click next, please? We have improved by 20. We also improved questions outside expected range. And we have only landed up with 5 questions that needed improvement, showing that our method and how we went about it is really worked. But we shared our program success with our executive team, with our partners, and we were able to consolidate investment from King's College Hospital into the further strategy to continue with improvement work, to sustain this work and to continue exploring new models of care. To Stephanie, please.
Sorry, take myself off mute. Thank you so much. I'm Stephanie Hall. I'm the Partnership Manager from Macmillan Cancer Support. I cover South East London, and I had the pleasure of working with Irina and co on this programme. So, partnership working. Macmillan has worked in partnership with King's for over 25 years. In 2017, due to a number of changes within the Trust and within Macmillan as an organisation, we took the exciting opportunity to partner in a much more strategic way, working together as organisations, but more importantly, with cancer patients to plan for longer term, more sustainable changes. Looking at the Macmillan funding model and enabling and sustainability, Macmillan's Pump Prime model of funding enabled King's to set this programme up. So by working together with our patient and public engagement team, service development team and impact and evaluation teams meant that we could really focus on the planning work to strengthen the bid for support. Innovation, ambition, vision and passion. The programme was incredibly ambitious. The only way to manage the complexity and the interdependencies of the 9 work streams was by having a really clear programme approach, which in itself was quite innovative for King's. Other ambitious and innovative benefits of partnership working were the securing of cancer quality improvement as a trust priority, raising the profile of the programme and increasing engagement of staff. Macmillan's support in enabling and delivering events such as the Cancer CNS Community of Practice meant there was time for CNS teams to work together, and recognising the importance of the cancer workforce and importantly enabling and supporting them to make impactful change was and is imperative to success. Outcomes and delivering successful change. The NCPES acts as an indicator of the quality of cancer care and patient experience. So one of the measurables of the programme was therefore to enhance the outcome of the NCPES scores for King's. King's NCPES improvement in 2019 meant an overall improvement for the South East London Cancer Alliance. And as an organisation, Macmillan seeks to drive equity of access to care and support across a healthcare system. The programme and NCPES improvements at King's have contributed to improved outcomes for the South East London cancer population being treated and moving through the system. And transferability and dissemination. The success of the programme on patient experience has been of significant interest to the Trust as well as other NHS organisations and partners. The Trust have substantiated the Cancer Quality Improvement Lead role, which is a fantastic development. It comes as a direct result of the impact of the programme and programme management, and is the first role of its kind in cancer at King's. They've also recognised the importance and the impact of the King's Cancer Patient Voice Group, which Andy will tell you a little more about in a second, requesting their support to develop their 5-year organisational strategy and recognising the group as a key member of the new Trust Cancer Board. Huge learning from Macmillan. We've shared the immediate successes of the programme with Macmillan London Lead Cancer Nurse Forum. We've got planned share and learn events for our service development and partnership teams. And we've also shared the learning with the South East London Cancer Alliance, which in turn is helping to bring about system level change across South East London. And we're delighted to be working with King's on supporting development of the next phase of cancer improvement work. And I'd like to pass over to Andy at this stage. Next slide, please.
Okay, a little about the voice. I'm a patient, or hopefully an ex-patient. We're patient-led, we're patient-managed. We aim as a group of patients and ex-patients to minimise the resources that were required by us that the Trust have to provide us, so that the Trust can dedicate more of their efforts to doing the things that we can't do. We're patient-led, managed. And we challenge ourselves to be accountable to our fellow patients. And to be accountable to our fellow patients, we have to have a very good understanding, as best possible, of the nature of the profile of our patients. So we spend a lot of time analysing the data that King's give us by demograph, by ethnicity, tumour group. We're looking now at pathways. So we have a truly good understanding of the patients that we seek to represent. And it's only by understanding this information that we can help King's and Macmillan prioritise the care and the initiatives and the solutions that they're going to provide King's patients for the future. And whilst it's wholly appropriate that we sit under the governance structure of King's, we welcome that and we adopt the values of King's. It's also important, and King's have recognised that we retain our autonomy. Because the autonomy places us in a position where we can still, we're not there as a bunch of just, do-gooders trying to do good things. We're also there to represent the interests of patients, and sometimes the interests of patients can be challenging. And we have to have that challenge, that opportunity to challenge. And it gives patients the security that they can come to us, they can voice their concerns. We've got we use evidence a lot to support our arguments, but they're safe in the knowledge that whatever their concerns are as far as patients are concerned, we will get to them over time, because we have a priority matrix which we set up for ourselves, so we can demonstrate why we encourage the Trust to make the decisions that they do. And it's that integrity, I think, it's that integrity of that relationship which gives it such strength within the partnership. Next, I'm going to hand on now back to Irina, I think.
Sorry, Here's just a demonstration of Commons with all partners that we've been working, and it's just to show that we didn't done this alone. And there is only some of the teams present today, and in the next slide, some of a photo of a team, and we're very grateful for all stakeholders' involvement. And without the team support and without our partner support, we will not be able to make these improvements. Next slide, please. Thank you very much.